Hi, I'm Dr. Eric Horwitz, and I'm the chair of the Department of Radiation Oncology at Fox Chase Cancer Center and the Lewis Katz School of Medicine at Temple University. Located on the outskirts of Philadelphia, Pennsylvania, Fox Chase Cancer Center is an academic institution with an emphasis on oncologic training. Our Radiation Oncology Residency program is an example of this. The mission of the Department of Radiation Oncology at Fox Chase is to train future physicians who will treat common and rare cancers, provide exceptional care to patients, and become innovators and leaders in the field. As a freestanding NCI-Designated comprehensive cancer center, not only will you work with leading clinicians in radiation oncology and other oncologic specialties, but you'll also be involved in research initiatives and follow them from their conception to adaptation into clinical practice. At Fox Chase, we've been training the newest generations of radiation oncologists for decades. Our program provides trainees with a broad knowledge of clinical oncology, radiation biology, radiation physics, and biostatistics through a diverse program that incorporates didactic and case-based instruction, clinical experience, research opportunities, and laboratory experience. A recent analysis measuring U.S. radiation oncology resident productivity found that Fox Chase was among the top 3 most productive programs for residents, with one of the highest averages of first author publications per resident. Over the years, many parts of our residency program have been refined through feedback from our residents. This feedback has inspired us to send residents to a yearly anatomic contouring boot camp and revamp our lecture series to a blocked afternoon schedule, helping to create the most impactful and effective schedule for our trainees. We've long supported residents to travel and give presentations at national meetings. As a resident, your experience at Fox Chase will enable you to easily meet all of the requirements needed for board certification. Brachytherapy. At Fox Chase, you'll gain a wide breadth of experience with brachytherapy for prostate, GYN, GI, sarcoma, and some head and neck cancers. You'll get enough experience with this technique to be comfortable in future practice, and many past residents have gone on to start their own brachytherapy programs. Hypofractionation. For 2 decades at Fox Chase, we've set the standard for different hypofractionated techniques. From stereotactic body radiation therapy, SBRT, to stereotactic radiosurgery, SRS, and now adaptive radiation therapy, we've led some of the original clinical trials for both prostate and breast cancer in the early 2000s and have continued to expand the use of SBRT ever since, especially using adaptive SBRT to treat oligometastatic disease. Pediatric rotation. Our trainees do their pediatric rotation at the University of Pennsylvania and the Children's Hospital of Philadelphia, allowing our residents to get high-level experience without having to relocate. Board certification is something on the forefront of every resident's mind, and for more than 2 decades, our residents have achieved a 100% first-time pass rate. Our physicians are dedicated to supporting our current residents and continuing this tradition. One way we do this is by incorporating cross-institutional mock oral boards into our program. Rather than a resident simply doing mock orals with departmental faculty they're friendly and familiar with, we exchange residents with other Philadelphia programs to better simulate the real board's experience. Hands-on apprenticeship is the cornerstone of any residency program, and at Fox Chase, our residents have the opportunity to actively care for all of the cancer patients in our clinic. You really get to experience what it's like to be a practicing radiation oncologist following patients on their treatment journey. Along with clinical experience, our residents attend on-site lectures covering the latest technologies and basic sciences of the field. This includes dedicated physics lectures and radiobiology lectures shared with the University of Pennsylvania residents. Our residents have the chance to work with outstanding state-of-the-art technology used in both standard of care treatments and in clinical trials. One such example is Fox Chase's work with the microtron. We are the only location in the Western Hemisphere with this technology and are in the midst of a phase 1 clinical trial that has practice-changing potential. While Fox Chase's advanced technologies are a key component of our residency program, our commitment to educating our residents and the overall culture are important as well. Our residents not only come here for an excellent education, but also for the support network of the attendings and their commitment to the success of the next generation of radiation oncologists. Our residents become a key member of the team, and myself and Dr. Stephanie Weiss, Director of the Residency Program, are personally invested in your success. Our commitment to you goes beyond your residency and extends into helping you find employment post-training. past residents have had great success in getting the jobs of their choice and in the regions they desire. And our attendings connections, involvement in ASTRO and the professional societies, and our own professional advice will support you as you look for the next step in your career. At Fox Chase, our entire Radiation Oncology team is dedicated to our residency program. We hope to welcome you onto our team soon.